Hello, good morning, everyone. Welcome to the webinar today. My name is Zoe Wilkinson. On behalf of Lung Foundation Australia, I'd like to welcome you to this consumer webinar for pulmonary arterial hypertension. Through this virtual meeting place today, we're gathering from many parts of Australia, and I'd like to start by acknowledging the traditional owners of country and their continuing connection to land, sea, and community. For myself here in Brisbane this morning, I'm on the lands of the Yagara and Turrbal peoples, and we pay our respects to them and their cultures and to elders, both past and present. In honour of World Pulmonary Hypertension Day today, we're presenting this webinar around championing your care. We have a fantastic panel lined up with both patients and clinicians here to answer your questions and share both lived experience and expert clinical insights. This webinar will be hosted by the lovely Tegan Dunmore, who is one of our consumer advocates living with PAH. Before I pass over to Tegan today, I'm just going to briefly run through some housekeeping. Firstly, today's webinar is being recorded and will be made available via our website at a later date if you can't stay for the whole duration. You'll be notified via email when this recording becomes available. Secondly, we've got our Q&A box, and Q&A questions will be held towards the end of the session today. So please feel free to submit your questions via the Q&A box, and you can access this in the toolbar at the bottom of the screen throughout the presentation. Please note when you are submitting questions, these should be of a general nature, and any individual specific questions need to be referred to your treating doctor. So I'm going to pass over to the lovely Tegan to introduce ourselves and lead us in today's session. Thank you.
Hi everyone, I'm Tegan. I'm in my 30s. I've had PAH since 1994. Way back then, there was not a good prognosis and not a good selection of medications to start on. But advances in medical technology and all sorts of things have got me through to where I am today. I live independently. I work as a lung cancer coordinator at a local hospital to me. I run a small business, and I'm really keen to share my experiences and my journey with you all. I'm on triple therapy, and I've managed to travel to over 20 different countries doing so. So I hope to share some of my insights today. I'll hand over to Maury or before we get started, I'll hand over to our speakers to introduce themselves individually. First off, we have Maury. I'll get him to tell us a little bit about his journey and share his background.
Thank you everyone for joining. I'll share a bit of my experience with PAH and how it's affected me. I was diagnosed in late 2021. I was actually told on my birthday in November that I had PAH. It came as a shock. I didn't know what it meant. I live in Proston, which is a small town in Queensland, just northwest of Kingaroy. It has limited facilities, a population of about 460, and a fairly close community. I love camping and fishing, and this has affected my lifestyle quite a bit, but I'll get into that later. That's enough about me.
Thanks. Next up, we've got Teresa. Do you want to introduce?
Good morning. My name is Teresa Levine. I live in Sunshine Coast in Queensland. I have been diagnosed also in November 2021. It has been extremely challenging because it took almost 2 years to actually put into the right boxes of diagnosis what I've got, that I've got the PAH, and before that it was just a nightmare. I didn't know what was going on. My whole body was just reacting very badly, and seeing few specialists, I was told I'm fine. I've got a bit of bronchitis, and that's what it is. And it wasn't bronchitis. I went to my GP and I cried. And she says, we'll put you into a hospital. And then that's where I start my journey discovering what exactly I had. So I think I'll tell later a little bit more. Thanks.
Thank you for that, Teresa. And I will be really interested to hear both of your stories. Now we've got David, who's one of our clinicians.
Thank you, and thanks for the opportunity of talking. I'm glad there's such a turnout. Pulmonary hypertension is something I've been very passionate about and been working with for the last 20 years. I'm a consultant physician at Westmead Hospital. I run the pulmonary hypertension service there. I'm also on the board of directors of the Lung Foundation and chair the pulmonary hypertension committee there. I'm really passionate, Teresa, it was interesting to hear that it had taken so long. I'm really passionate about trying to improve early diagnosis and early recognition of this condition, because that's seminal to improving the long-term outcomes. I'm very keen to also standardise care across Australia so patients, regardless of where they are, can have access to appropriate use of medications, clinical trials and maximal therapies where appropriate. Thank you, guys.
Thanks, David. Now, next up we have John.
Thanks, Tegan. Again, thanks for the opportunity of being involved this morning. Like David, I've been involved with PAH and the management of patients for about 20 years myself as well. And I'm, again, quite passionate about the disease, and I work in public and private and do the lead physician work at the Prince Charles Hospital. Obviously, there we've got all therapies, including IV epoprostenol for the state, and also the transplant service. And I wear a number of hats, and currently the president of the Society for Pulmonary Hypertension of Australia and New Zealand from the medical side.
Amazing. Thanks, John. You guys sound like great people to have in the pulmonary hypertension world. My doctor has sort of similar passions to you guys, so it's great to hear that other states also have, doctors with such passion. Thanks all for sharing all those insights into who you are and what you do and your relevance to PAH. We'll kick off today's webinar with some pre-submitted questions via the registration forms. And then as we go along, once we pass through those, we'll then open it up to the live Q&A. So as we go through, please send through your questions and we'll choose some towards the end. All right, first question here today is, what have been the most challenging parts of your journey with championing your care, and how did you overcome these? Now we'll start with Maury, if that's all right.
Thank you. As I said, I was diagnosed about 16 months ago. The diagnosis, unlike Teresa's, was very quick. I was admitted to hospital. They thought it was a heart condition. I was transferred to the PAH and Princess Alexandra Hospital in Brisbane, and they did a right-hand catheter, which showed that I had severe PAH, but in a mild form, which sounds contradictory, but it probably makes sense by the end of this. The things that challenged me most was the lack of knowledge about it. It was both mental and physical, really. The lack of knowledge about it and what the future might hold mentally, it concerned me greatly. The physical challenges, I think everyone experiences these. Everyone who has this disease experiences these: lack of energy, breathlessness, tiredness, lightheadedness, occasional heart flutters and chest tightness. Overcoming these were the biggest challenges. I accepted that I had the PAH. I did a lot of research. I joined the Lung Foundation and used their resources. I signed up to the PAH peer group team, and I asked questions there. I asked questions of my medical team. So that alleviated a lot of the mental anguish I was going through. Just accepting that I've got it and adjusting my life accordingly was a big deal. I stopped trying to foretell what the future might hold and decided to live with what I had and the energy levels I had. And basically, I'll just go through a few notes that I made. You need a lot of support with this. There's no doubt about that. The Lung Foundation have a lot of resources available. The peer support group have a lot of people that are going through the same things you are and have been through what you're going through. Contact through there. I managed to make a couple of good peer acquaintances. One I'm in touch with virtually weekly, and we just socialise basically, say how we're going and follow up if we're going through tests and see how they went. And just being able to talk to someone who is in the same situation as I've been has really helped. There are a few things that I found out in my research that have helped me a lot. Accepting that my energy levels were low and I couldn't work anywhere near as hard as I previously did. I've discovered that my best time is in the mornings. I'm fresh. I can put a couple hours of not too heavy work in before I start getting tired. I discovered that listening to my body was extremely important. You don't overdo work around the house and that sort of thing. I discovered that very, very quickly. If I get tired, I rest. And I think that's really, really important. Breathlessness we're dealing with later, overcoming that. That's probably one of the most frightening parts of having PAH is when you can't catch your breath. It is extremely frustrating. I've learned to just relax, breathe, and I'm sure that we'll go into that in a lot more detail later, and I might have some input there. As I said, morning's the best time. We have good days, bad days. Basically, your diet is important, low salt, not too many fats. Exercise is also important. Having people around you that you can talk to, because this is such a small community. When I first moved here about 3.5 years ago, I was restoring a house and I'd be out there all day working my butt off, and suddenly I wasn't. And that was recognised very quickly in such a small community. And not many people knew what PAH was. So a lot of people in the town are now aware of it, and we've got good neighbours that have offered to help with any heavy lifting I need done, and just generally help any way they can. So that's been a great support as well. The medical team at the Princess Alexandra Hospital have been brilliant. They've answered all my questions. I've got a nurse I can phone anytime. And if I've got any issues, or if I feel I have symptoms that should be addressed, I can call up and get help from them. They've also been really great because I live in an isolated, well, not isolated, but a distant community from the hospital. I've been able to, through them, organise the Kingaroy Hospital to deal with most of my tests and that sort of thing, which has saved me a lot in travel and a lot of stress. So that's been really great as well. So to sum up, basically, know your body, what you're capable of, recognise when you're getting tired, work around it, find out when your energy levels are going to be good and try and fit it in then. I always keep my afternoons free because I know basically I can't do much in the afternoons. I don't know about others, but if I have a fairly large meal, I am stuffed and I have to have a sleep. I don't know whether that's my age or whether it's part of the PAH. but I just follow what my body tells me to do. My wife's been really great in supporting me. She does things like carry out the bins and that sort of thing, household chores, lawn mowing. I used to have a push mower. I've still got it, but I've also bought a ride-on, so I can do that quite easily. I also do my neighbour's yard because it takes nothing to sit on the ride-on and drive around. It's quite satisfying, actually. Little jobs around the house I still do. I'm building railings on the front deck that I built prior to PAH, putting railings up now. I'm just doing a bit at a time, pacing myself, and certainly not overdoing it.
It sounds like you've put some great strategies in place, Maurie, and you've sort of been really introspective about, you know, yourself and how your disease is presenting and managing it as best you can. So that's really good. Yes.
But yeah, as I said, the support is brilliant. You need the support, and any questions, never be afraid to ask a question. That's about all I've got to say at the moment, and I'll answer anything else later.
Thanks, Maurie. We'll quickly head to Teresa and see if she has anything to add to that. I know her journey sounds a little bit different to Maurie's, with a sort of protracted course before her diagnosis. Do you have anything to add, Teresa?
Just very briefly that in 2019, I have been overseas. And I had great difficulty to go on the stairs or anywhere uphill. And my sister suggested I should see the specialist. So I went and see Professor, but because I didn't have much time, he was suspecting that I have something like that. He says, I cannot put the diagnosis just right now because you need more tests to be able to actually confirm that. So he says it will be better if you go to your own country and have all the diagnosis correct, and then you can start a treatment, because you have to be now on a regular visit to your specialist. So when I came back, I went to, I was actually frightened because what I read on the Dr. Google wasn't really that fabulous. And I was just freaking out and thinking, like, I worked with people for 30 years. I always know what to do for others. However, with me, it was just like, oh my God, what's happening? I don't know. It's just that lack of knowledge was something that on my stars. Then I went to the specialist and he told me, he put the stethoscope, and I had few tests that I had done. And he was saying, look, you're right. You don't need to see me. And I'm saying, well, I have seen Professor in overseas, and that's what he was telling me. He says, I don't see anything. Okay, so I went back to my GP, and lucky that I had a really good GP, because before everyone was saying, I have bronchitis or I have asthma. Nothing to worry, nothing serious. When I went to her and I started crying and I said, look, that's what I've been told overseas. And she was saying, we'll send you to a hospital. They will sort it out. And they did.
That's great to hear that you are your own advocate in that situation. It can be difficult to sort of voice those feelings. You know, you've had a professor overseas tell you one thing and another doctor tell you another. So that's really great that you could be your own advocate in that at that time.
The confusion, the lack of really transparent information, and getting to a good doctor that will tell you, look, and, you know, when I got what Maurie is saying, I've experienced everything as well. I tried, now I'm aware, now I know, I have a heaps of knowledge. I'm sure it's just that little, but at least I know what's happening in my body. At least I know that, you know, well, you are exhausted. Well, sit down. Nothing will go away. You will do that tomorrow or day after tomorrow. And support, because I live on my own, I don't have great support. Even my own children were saying, well, you look okay, Mum. What's wrong with you? You know, and then it's just that disbelief. Or even my daughter was saying, oh, look, you're not that old. You can make the 2 sets of steps. And it's just that lack of understanding what is it you're going through. It's something that I think the Lung Foundation is working really hard to actually put so much knowledge, not only for the patients, but for the family. And then that information we can pass on other people as well. But yeah, it's extremely difficult.
So true. PAH is such an invisible illness that it can be hard to look like this, but feel so vastly different. Thank you, Maurie and Teresa, for your insights. It's been great to hear your stories and your journey and how you've overcome them. We'll pass the next question on to our clinicians. So our next question is PAH a disease that gets progressively worse, or is a medication enough to stabilize it? If we can hear from David first.
Look, thank you for that. Just before we move on, I just want to thank Teresa and Maurie for sharing, but also confirm, because it's not an outwardly visible disability, it's almost discriminated against in the community from people who have obvious impairment. And as such, even though your impairment may be just as marked or more than someone who has an obvious physical disability, you don't get the community support. And I've had patients who've parked in disabled spots and you know, people have jeered them and otherwise. And so I'm sorry on behalf of the community. I'm sorry that we have not got the message out there well enough, that people can be educated that breathlessness is real and is as disabling a symptom as any other physical disability, or even more so. So coming to the question that I've been asked to address, is pulmonary hypertension a disease that gets progressively worse? I'd like to take a step back and actually say that pulmonary hypertension is not one disease. And so prognosis and progression actually vary according to what your pulmonary hypertension may be from. So someone who has pulmonary hypertension secondary to blood clots, for example, certainly their condition may progress, but there's also the opportunity that surgical interventions and other things can actually reverse the condition, not just stabilize it. In some cases, even cure it. Likewise, some pulmonary hypertension is caused by medications and drugs. And in those circumstances, if we're able to address that medication or that activity, then we can change the progression. Now, taking those exceptions, the majority of other causes of pulmonary hypertension in group 1, which is where we're mainly treating our pulmonary hypertension patients, is generally a progressive condition. Now, progression will vary depending on what the underlying cause is, and also what treatments and what stage of the condition you've been diagnosed in. Having had the fortune of working with this condition for 20 years or so, and John will certainly probably agree with me, what we've seen in the landscape of treating pulmonary hypertension is that the progression we're seeing is generally slower. And while someone may have disabling symptoms up front when they're started on appropriate medications, we find that there's a marked improvement in their symptomatology and that there is a stabilization in their condition. Then over the course of time, as long as we're using appropriate therapy and escalating care we're able to, we tend to see that there is progression, but generally in a manner that we can address up until a certain stage. So it is a condition that progresses, but with appropriate management, we can stabilize it and improve quality of life. The other thing that's really important is when people say progression, often we find that progression of symptoms occurs at times of other disease. So someone might have stable pulmonary hypertension, but might end up with COVID or influenza, or have a fall, or develop kidney problems from other issues. And the occurrence of another medical problem can often lead to a worsening of the symptoms and worsening of the condition. And so that's why prevention is important. So we obviously encourage all of our patients to be fully vaccinated. If you do catch COVID, to get onto antivirals as quickly as you can. And other things can affect what the progression really means there. So yes, but no, and with hope is the answer to that question.
Yeah, I totally agree with you, David. Just yes, for PAH, it is a progressive disease, but with the advent of combination therapies, double, triple, that we've been able to stabilise patients now for many years. And I'd just like to reiterate, probably the thing about is being in contact with your treating team and having regular reviews, because sometimes we can pick things up, on the echocardiogram, blood test, that we can say, actually, things are changing. You might not feel it just yet, but we can start seeing, if someone's blood test, the BNP or NT-proBNP is going up, there's some changes on echo, that we sort of intervene early rather than waiting till your symptoms have progressed to a point where we might not be able to get you back to where you've been for the last several years. So, and then, with medication, not just the standard medications that we get through the PBS and your centres, or with your treating physicians looking to see at clinical trials with some of the newer agents that are that we're looking at, or new molecules.
No, that's great, John. I'll share a little bit of my experience on disease progression and getting a little bit worse over time. As you said, I didn't actually have any symptoms when I was getting progressively worse, but clinically on my echocardiogram, there was a significant indication of changes in my cardiac output and all sorts of things. So, over time, adding an extra medication here or there to halt the progression, but also showing improvement in my condition over time, back to sort of a baseline, I guess, over time. So it's great to be around in 2023 when there are, options available to us. And I think being open-minded about discussing those things with your clinicians and your practitioners, that, you may need to adapt and change and take other medications over time. So no, that was a great insight, guys. Thank you so much. We've got our next pre-submitted question. How do I exercise if I struggle with breathlessness? Now, this is a great question. I'm not particularly too breathless as a general rule, but I've sort of being aware of myself, I choose to do activities that don't cause me to be breathless. So I choose things like hula hooping or walking the dog, or even being a little bit more thorough with my cleaning, so that I'm getting my heart rate up a little bit and I'm exercising while I do some of the activities and the chores that I have to do around the house. Teresa, do you have any insights on that as well?
Just like you, I have a big dog, and he require exercise quite regularly. So twice a day I walk. I do all this activity in the house. So I used to go to gym, but I'm just a little bit unsure at the moment, because there are days that I don't particularly feel like going and joining the gym. So maybe a little bit later if I feel better. But I think I do walk an hour and a half daily. So, yeah.
Do you find that you get breathless on your walk?
When I do, my dog knows now. He will stand and watch me. He's just like, hey, did you catch your breath? We can go now.
Yeah, perfect. David, do you have something to add?
Yeah, look, breathlessness is a symptom that is common across many lung diseases, and we've learned a lot of insight into managing breathlessness from other conditions. There's some interesting papers that breathlessness is the paradox in pulmonary hypertension, because you're short of breath, and often because you're short of breath, you may avoid an activity. And by avoiding the activity, you then avoid the breathlessness, but you also avoid the opportunity for an increase in your cardiorespiratory fitness. And therefore, the next time you try to do that activity, it can be harder. And then you can enter a cycle of breathlessness that becomes very difficult. There was a fascinating study that came out of Germany that showed that with actually structured and forced exercise programs, we could achieve improvements in outcomes from the point of view of activity and breathlessness scores over and above many of the medications we use.
Is that something like pulmonary rehab that a lot of
cardiac rehab? Yeah.
Or cardiac
so
rehab?
It's very similar to pulmonary cardiac rehab. And so when we take people through a proper breathlessness clinic and a cardiac rehab program, we actually talk about embracing breathlessness. So I give my patients the analogy of when Usain Bolt has run the 100-meter race and they stick a microphone in his face at the end of the race, he's breathless, he can't talk. But is he unhappy? No, because he knows that he's done something to achieve something and that the breathlessness is commensurate with the activity. And whilst I'm not joking and saying that we'll all be able to run a 100-meter race, what I'm trying to say is that by understanding that breathlessness is your body signaling that you've been using it and not running away from breathlessness, sometimes we can actually learn to overcome it in a structured exercise program. So,
yeah, it sounds like there's a little bit of a happy medium there, doesn't it? It would be individualized for each patient.
Yeah, and trying to avoid dizziness and lightheadedness and chest pain obviously is important, but just standard breathlessness is not something to generally recommend that we avoid all the time. Thanks.
Yeah, perfect. That's a great example. Maury, do you have anything to add to that? Do you do any exercise?
Well, basically, I follow a standard routine in the mornings. The slope of the land that I'm on, it's about 1/4 of an acre, is about 5 degrees, and I've got a cat that I take out every morning, and it likes to roam around the yard, and I'm always following it around and making sure everything's okay. I also, I'm virtually walking up and down the length of the property for a couple of hours, doing different things, some little chores. That doesn't make me particularly breathless. If I'm carrying something uphill, that really knocks me. But I do persist. Breathlessness is not that severe that it deeply concerns me, and I quickly overcome it if I feel it is getting too extreme.
Yeah, perfect.
So,
I think being aware of your body, like you said before, is one of the more important things.
It is, yeah. I've really found that listening to your body and dealing with it the way your body feels it should deal with it works really well for me.
Yeah, great. Thank you for sharing, Maury. Thanks to all our participants for sharing all of those questions. Now, just remind everybody, we do have the Q&A function down the bottom of your screen. Please submit any questions that you have. We'll have some time at the end to answer some of your questions that you have while we're live on the webinar. Next up, we have, what are the long-term prospects for someone living with pulmonary hypertension? Now, I'll open that up to John, I think we'll start with.
Yep, thanks, Tegan. Obviously, we've seen a great change in the last 20 years. And thankfully, we live in a country where we've got funded therapy for up to triple therapy now. And particularly what I've seen too, because I work in a transplant centre, is that the referrals for transplant is still a potential treatment for PAH and someone who's severe. That my referrals to that service have been greatly reduced because of the therapies that we have now, and that's the combination, is it dual and now triple therapy, and with that we've seen stabilisation in patients that we once in the past, if they're on monotherapy, would not get that period of stability. I think it's also an exciting time is that it hasn't been forgotten, PAH. There's a lot of research happening, and myself and David are involved with a number of clinical trials. And the most recent one was the STELLA trial that was published in the New England Journal in March with a new compound called sotatercept, which showed improvements in patients that were even on triple therapy, including IV epoprostenol, not just walk distance, but also time for clinical worsening or hospitalisation. And then, as I said, there's other molecules that we're looking at that David and I are involved with. So it is a time where we're going to have other agents and probably more individualised medications for patients with PAH. So I think you know, we've got good foundations with the therapies that we have now, but it looks like we'll be able to build on that. And obviously that will improve people's quality of life and obviously extend their life as well. David, would you agree?
Yeah, I'd wholeheartedly agree, John. I think sometimes our patients feel that perhaps we're putting rose-tinted glasses on because they think that we're glossing over the severity of the condition. But there has been such a progression in what the targets for treatment are and what the outcomes of treatment are. And now, as you know, we're working with molecules not only just to stabilize symptoms, but to actually try and remodel and reverse disease. And so the future does look vastly better. I think with that in mind, getting yourself to a clinical centre that has access to trials and maximal therapies and support and regular risk assessment is critical. And in the Australian landscape, some people are being managed in smaller centres, some in larger. I would encourage you to use the PAH Charter to actually ask your clinicians about things that you feel are important and to see whether they're involved in trials and to see if they are they're managing their pulmonary hypertension patients according to world guidelines, because we want you to have your best outcomes. Because if we can use our current therapies to stabilize until we have other treatment options that can improve things further, then that's a win-win for everyone.
I think that's a great summary. I think some of the big city centres and the big city hospitals have a lot of resources, and they'd be very willing to share them with and there's shared care programs and telehealth. There's lots of things that we can do to support patients remotely. We live in a country that's so vast that, accessing, primary care from a physician who's doing the research is important, but also equally accessing medical care close to home is also important for a lot of patients, and travel times and things like that are not feasible when you're breathless. But I think there's lots of things we can learn from, the last couple of years in shared care and opening the world up to more patients. I think that's great. We've got our last pre-submitted question, but remember we've got a couple of questions coming through in the Q&A. So please keep sending them through and we'll choose some to go forward. Our last question is traveling going to become impossible as my disease progresses? Well, I can tell you that my disease has definitely progressed over time. And I have been to multiple different countries throughout that time. I was diagnosed as a child. I was only 4 or 5. So I actually didn't even consider that travel would be an option until I was about 17 or 18. And I asked the question because my friends were going to Bali or this or that, New Zealand, traveling around. And I just asked my doctor the question. They were like, oh, yeah, of course you can get on a plane. You can do whatever you want. You're doing really well. And it opened my mind to a whole world of things. So from then on, I've sort of made a savings plan and a goal to travel twice a year internationally. And I did it. I've done it, apart from the COVID times. I actually also then took it one step further and I planned a 3-month holiday in Scandinavia over winter. And I did it with hiccups and I did it well, and I came back with the most amazing stories, and I'm so thankful to be able to have done that. I think the thing you've got to keep in mind is that you have to do it with what you're able to do. So I was able to walk kilometers a day around Spain or Italy, but if you can't walk that far in Australia, I think you need to take that into consideration for your holiday planning. You do also have to go through a few little hoops to be sure that you're safe to go. So some patients have to do breath tests beforehand to make sure the pressures on the plane are fine. You may have to have an echocardiogram right before you go just to make sure everything's safe. But I think it's something that is definitely possible. You just need to be mindful of your limitations. Maury, do you have anything to add to that?
I'm not planning any overseas trips, but I am planning to caravan throughout Australia. I've done a test run in our previous van and found that I could cope quite adequately. As I said earlier, I'm great on flat ground. I can do kilometres. My 6-minute walk that we undergo yearly or 6 monthly sometimes have been pretty standard. They've been very good. But as I said, carrying stuff uphill is not real feasible. But travelling in a caravan will suit me down to the ground, and I look forward to doing it.
No, that sounds like a great way. You've adapted your style of travelling and still getting out there. Even as your disease progresses, you've got a backup plan, you've got things thought through. So I think that's really great. Thanks for sharing that, Maury. David, do you have anything to add to that?
Yeah, I just wanted to give an anecdote from one of my patients. She has really, really severe pulmonary hypertension, is oxygen dependent. That's made it a little bit harder for her with travel. And previously when she would travel, we'd have to increase her oxygen flow rates on the plane. It got to a stage where even with higher oxygen, it wasn't safe. But she's taken to cruising, and so has used sea level transport as a means of still being able to explore the world. The main risk obviously with that has been infection, and so she's been quite diligent with hand hygiene and mask wearing and vaccination and things like that. But it gives me joy to see what she's still experiencing despite all the potential limitations. And so I would encourage you not to put the barrier up.
No, I think that's a great idea, David. There are lots of ways you can sort of substitute your ways of traveling to still get that sort of, I don't know, that little bit of a high when you travel and that experience and all the joys you get from traveling, if that's what you're interested in. You just have to think of ways to be adaptive, I think, and that's a really great example. Now, thank you so much for answering all of those pre-submitted questions. We'll continue to send through questions as we go, and we'll try and answer as many as we can. We will move on to the live questions though, and just be aware that the questions should be of a general nature and any specific questions need to be referred to your treating doctor. All right, we'll go to our first question, which I think maybe John might be best to answer. Is pulmonary hypertension considered a cardiac or a respiratory condition? One of our listeners has a friend who's told her that she sees a cardiologist for follow-up, whereas I see a respiratory physician, but as a pediatric patient, I was seeing a cardiologist. So I'd love to hear your insights, John, into that question, if that's all right.
Yeah, so PAH is a lung disease, but it obviously with the constriction of the blood vessels of the lungs, the bystander is the heart, and that's where the right ventricle can dilate and fail in time. So it depends on which state. Most pulmonary hypertension services developed out of a transplant unit. Like I'm a respiratory physician, and the pulmonary hypertension service developed out of the lung transplant service. For example, in St. Vincent's down in Sydney, you got Eugene Cochlear and Anne Keogh, they're cardiologists, and their pulmonary hypertension service grew out of a cardiology service. So both respiratory and cardiologists do manage this condition, and it just depends on which state you're in, which city you're in, but definitely both professions, if they've got an interest in PAH, can look after this disease.
Yeah, perfect. That's a great way of explaining it. Thank you for that. David, are you aware of any new therapies coming up available in Australia that will be approved?
So we're all waiting to hear about sotatercept, I think. So recently, with a lot of the work from the Lung Foundation, the Pulmonary Hypertension Society, and the patient advocacy groups, we had triple therapy approved. I was actually texting in an answer for someone asked online, what is triple therapy? So I might just, rather than typing, to speak to it. When we treat pulmonary hypertension, if we use one class of medication, it's called single agent. If we use two classes of medicine working at two different target points in the pulmonary vasculature, then we have double therapy. And if we're using 3 different classes of medicine working at 3 different sites. We call that triple. And then if we use a 4th, then it's quadruple and so forth. So triple therapy is using 3 different therapies. At the moment, we've had PBS funding for 3 therapies, but we don't have anything that I'm aware of that has a current PBS application in process. But I do think it won't be too far away. John, can you add to that?
So a couple of things first with regards to Sotatercept. It hasn't been approved in the United States yet with the FDA or Europe, EMA. So that's where that company will go there first because of the bigger markets. And that's usually then an easy transition for the TGA to be able to use the drug here in Australia. But then it'll be negotiations with government with getting this on the PBS. And sometimes that can unfortunately be a bit protracted, again, about costs for government. And then there'll be submissions from ourselves. Then there'll be public submissions. I know LFA involved for advocacy. And there can also be individual patient submissions when it does come up to be discussed at the PBS. So it's still early stages. So timelines, I don't know, but it is definitely something that we'll push for from a physician and society point of view once it becomes up for submission.
Yeah, great. Thanks for answering that, guys. Yeah, I think being on the triple therapy is, been life-changing for me. For the large majority of my ill journey, where I was very, very sick, waiting for a transplant, I was on the dual therapy, and it had a significant effect. But for my particular case, the triple therapy is what really aided my clinical journey, and I'm very grateful that at that time I was allowed on the triple therapy. It was not encouraged in pediatrics, and it was difficult to get, but we got there in the end, and it was life-changing. So now it's great to hear that there's lots of changes and the drug's coming up. So we're hopeful that happens sooner rather than later. We might ask a question of our PAH advocates if we can. What support services have you found helpful in your journey? We've touched on the Lung Foundation information and resources. I'd just be interested from our panelists how they came about finding those resources. I was introduced through my clinic. There was posters and things, but it'd be interesting to find out how everyone else found it.
I was told about it when I was in hospital, and because I knew so little about it, I subscribed to the Lung Foundation. I found out about the PAH peer support group, so I signed up to them, and I also signed up to an overseas PAH support group, but found that horrifying. It was more negative than positive, so I unsubscribed to that, and I found it out through the hospital and through the professionals there.
Yeah, I think a lot of people have different needs when it comes to psychosocial support and mental health support, particularly managing a chronic illness. And I think it's great that you acknowledge that support group wasn't for you. I think it's difficult to sort of come to terms with certain things, and I think there are support groups that can be more beneficial to you than others, and sometimes you've got to find the right thing that suits you. Therese, do you have anything? Oh, sorry, Murray, go on.
No, that's for sure. I was just agreeing with you, Tegan.
Oh, perfect. Therese, do you have anything to add to that?
I found about Lung Foundation through donating some money. So I started reading and thinking, oh, yeah. So I think when I started reading, it was just an eye-opener rather than relying on Dr. Google, who is just scary and saying that you've got only 5 to 8 years life span. So yeah, I'm quite happy that I found that, and give me a lot of support and information that I needed.
Thanks for that, Therese. David, are you able to answer this question for us? What is your sort of spiel that you give to patients when they ask about the risks of using herbal medications with their PAH medication or any other medications that they might be using?
Good question. I like to usually recommend evidence-based approaches, but do understand that sometimes not everything has evidence for or against it. My general rule is, if you are considering a herbal medicine, have an open and frank discussion with your doctor, because what we've found on occasions is some medicines, even though they may appear innocuous, might affect absorption of other medications. They may interact with things that we don't know about. They may change clearance of other molecules out of the body. And they may have unwarranted and unexpected side effects. So I think if you are wishing to talk about herbal medication, wishing to consider them, by all means, find out what it is you're taking. When I've researched this in the past for some of my patients, I've actually found what has been discussed as the medicine may not constitute every ingredient that's in that agent. And therein can lie the rub, where what they may be using looks good on paper, but everything else that's in it may be causing more issues. So have an open and frank discussion with your treatment practitioner.
Thanks for that, David. I think we've got time for one last question, and it is regarding with pregnancy and PAH. If we could just quickly talk about that one before we wrap it up.
I think John and I'll probably try and answer that. But
yes.
what we know about pregnancy is it puts a huge demand on the heart in patients with pulmonary hypertension, and that demand might not just be for the duration of the pregnancy. It may also change the long-term outcome for that patient. So it's a very emotive discussion, and it's a very individualistic discussion. We have supported women through pregnancies with successful delivery and children, and sometimes they've been quite good in early motherhood. Sometimes they've been so breathless that they can't manage with the demands of early motherhood. So it is a very individual question, but it's generally not advised for, but it is a very individual discussion. I'll hand over to John, I guess, with more experience too.
Yeah, I just agree with David. It is an individual discussion, obviously, with the patient and ourselves. Also, we also get involved with the high-risk obstetric unit at the Royal Brisbane Women's Hospital as well. Having those upfront discussions about what the things that can go wrong during pregnancy because of the demands on the heart, because with the pregnancy, we have to look at changing medications because particularly the ERAs or bosentan, macitentan, ambrisentan are teratogenic. So we have to change medications prior to pregnancy, and then run example, epoprostenol through the pregnancy, talk about the time of delivery, how that's going to be done, ICU postpartum. So there's a lot of discussions beforehand. And as David said, we've got women through their pregnancies through to delivery, but then at times we haven't been so successful because of the patient's disease can progress during that time. So it's an individual discussion, risks, and yeah, it can be very challenging.
Have you found that with the significant changes in IVF and availability of those sorts of things that more PA patients have been asking you about, IVF and surrogacy and navigating those sorts of areas? Yes, yeah. So I've got one lady doing that exactly right now. Or they'll go have a discussion with their IVF physicians, and they might change their mind after they hear the risks involved. So yes, that has definitely come up, and I'm going through, as I said, going through that right now, actually. Yeah, so what I'm hearing is that pregnancy and PAH is quite a risky thing. Yeah. There's definitely a discussion that needs to be had with your primary physician about that, so that you can assess what those risks mean for you in your life. We do actually have time to answer one more quick question about financial assistance and PAH. Over time, I guess the financial issues change over time. Well, for me, it has changed over time. I have access to a social worker at my hospital, and they're a great resource to support patients and through navigate the sort of financial issues that you have. And I think they can be a great resource to have. I don't think they're there's not one way to answer that question. I think you'd have to take into consideration whereabouts you live, if you're eligible for sort of travel refunds, if you're, commuting to your local hospital, are you eligible for a disability support pension? Those questions need to be asked. If you're of the right age, are you eligible for NDIS? So it's not a question that we can answer specifically here, but I think there's lots of different avenues that you could investigate, I guess, and look into for financial assistance. Now, I think that wraps up our session. I don't know if anyone has anything to add to our financial question.
Tegan, I just want to say quickly, if you get the first rejection, keep working on getting it, because most of my patients, it's 2 or 3 times, unfortunately. Even despite doing what they've asked us to write or putting in further information, I don't know what they're looking at to say no, even at the second time. So it's a bit of persistence working with your physicians and your social worker. Don't give up on the first one.
No, that's a great point, John. That's a great point there. Definitely try again. All right, thank you everyone for submitting your questions, but unfortunately we have come time to the end of our webinar today. I enjoyed chatting with you all and did learn a few little tidbits here and there that I'll take on with me, and I hope everyone else back watching did as well. We'll hand back to Zoe just to wrap up today's session.
Thank you so much, Tegan. And on behalf of Lung Foundation Australia, thank you all for sharing your time, experiences. We really appreciate you all donating your time and giving us an insight into PAH. It's been a pleasure having you with us today, and I've learned a lot from the session, and I hope our participants have too. And I'm sure you'd agree that this has been some inspiring insights. If you do have any questions following today's webinar, you can reach out to the Lung Foundation, our Information and Support Centre. The number's on the screen now, but I'll just read that out. It's 1800 654 301, and that's option 3. You can also visit our site on the link below, and we have some information and resources on PAH and the other services that we offer. There's also the PAH peer support option that you can see there. We have various groups for people living with PAH to support them. That brings us to conclusion of our webinar today, and thank you for joining us. We hope you found it helpful in answering some of your key questions on living with PAH. Have a lovely morning and take care of yourselves and each other. Bye for now. Thank you.